Every third blind person in the world is in India, and here on the bustling streets of the city of Chennai, there's a rather unique temple that answers some of their prayers, a temple of the eye. Sankara Nethralaya, an organization founded with a missionary spirit to community service, started as a small eye hospital in 1978. Now it's turned into a vision care institution with cutting-edge research facilities contributing to the world's understanding of eye care, a teaching academy training the next generation of eye care professionals, and patient care that is some of the most technologically advanced, yet still remains compassionate and grounded. In many parts of rural India, access to non-emergency health care is almost non-existent. In the region surrounding Chennai, however, the optometrist's office from the big city pays a regular visit in one of the most state-of-the-art tele-ophthalmology units in the world. Each day, this van greets dozens, if not hundreds of patients for, at the very least, a simple eye exam. But oftentimes, the rural poor have lived their lives in isolation with much more severe needs. The father of this young boy, who was born mentally retarded and has steadily lost his vision, is being told that there is still hope for vision in one eye, but that the other eye must be removed.
It might rupture and it might cause bleeding. That is the reason right eye is being removed, not for the vision.
For cases that might be complicated but perhaps not as clear-cut, a video consultation with a certified ophthalmologist in Chennai starts via satellite.
Mild cataract, PSC is there, early PSC changes is there. This is the left eye diffuse image. It's a left eye.
In real time, an ophthalmologist is able to see, hear, and speak with a patient hundreds of kilometers away, oftentimes in their native tongue. The ophthalmologist also has the ability to view images of the patient's eye immediately. More than 5,000 such teleophthalmology consultations happen in a year. Every day, a new busload of pre-screened patients from rural villages arrive at the Community Ophthalmic Center in Chennai. Nearly half the people the organization serves pay nothing.
எந்த பொருளும் கண்ணுக்கு தெரியாது. இப்போ நீங்க நிக்கிறீங்க, இப்போ ஃப்ரீயா நல்லா தெரியுது, முகலாம் தெரியுது. முன்னால ஆபரேஷன் பண்றதுக்கு முன்னால ஒரு நிழல் மாதிரி தெரியும். மனிதனுடைய தோற்றம் முகபாவம் சரியா தெரியாது.
Each patient is given a battery of thorough eye exams before being prepped for surgery. Some procedures are as straightforward as the removal of cataracts. Others are more complicated, such as vitreoretinal surgeries, sometimes a byproduct of untreated diabetes.
On average, in the outpatient department, we see 250 patients a day in veterinary department, and we perform on average nearly 500 odd surgical cases in a month in the veterinary department.
Another specialty here deals with some of the smallest patients who suffer from what's known as ROP, or retinopathy of prematurity, a condition that affects prematurely born babies. Blood vessels don't finish growing till a few weeks after we're born. In premature babies, sometimes the vessels inside their eyes grow improperly or not at all, leading at times to retinal detachment or blindness.
Our center, even the pioneer who have performed and popularized the surgical concepts in the management of ROP, that is retinopathy of prematurity.
Sankara Nethralaya performs more than 25,000 surgeries a year, and even with this volume, they manage to keep their surgical facilities at levels of sterility and safety compliant with international standards. The infection rates inside these theaters are well below national and international averages. Most places don't have a special wing just for pediatric ophthalmology. This facility is so well recognized that patients are referred here from all over the country. For example, during these last 3 exams, Dr. Sujata Guha has been speaking 3 different languages and helping her patients' parents understand the condition of their children.
Right now, I expect good stereopsis for him.
Young and old patients alike have access to some of the most recent technologies that help doctors photograph, scan, and see into potential problem areas. It's one of the reasons countries like Mauritius and Oman point their citizens to this center.
we have grown from a very small organization to a big organization. All this has been possible from the wealth which we have created, both from the internal accruals as well as from the donations we have received from the community. Had it not been for the support which we have received from the community, I don't think we could have grown as fast as we have done over the years.
Above almost every door, on every floor and wing, are the names of the donors that have made these facilities possible. From every corner of India and even other parts of the world, they donate, sometimes enough to create a room or a wing. But so many more people donate what they can online. For as little as $50, they sponsor a cataract surgery, and online donations are slowly beginning to fund major surgeries throughout the year as well. For Dr. Badrinath, it's not just about raising funds, it's about helping take the organization to the next level.
What I would like to do is to create an institution which would take care of these difficult cases, what one would call as a tertiary care institution. Make rapid diagnosis using molecular biological techniques in those cases where we have no diagnosis now, and also perform surgeries which are not performed elsewhere within India, so that at least there should be one center in India which performs difficult and complicated cases, not looking for returns, but more to serve the community, providing this particular state-of-art surgical procedure at a very nominal cost, and also at the same time act as a training center so that more people from the rest of the country could come here, learn these difficult procedures, and duplicate our experience elsewhere in the country.
A clear vision to keep people coming to this temple of the eye. I'm Harisrinivasan.